I'm going to introduce our speakers. We're appreciative of them coming. And Carmelo Hernandez is the Director of Mental Health and Hygiene. And Amanda Straight is from Chautauqua Opportunities. We're the League of Women Voters, so I have to say early voting is still going on. There's some, the dates are back there. And I wanted to say something about homeless voting. Yes, if you are homeless, you can vote. People who are homeless can register to vote by identifying a place of residence. It can be a street corner, a park, a shelter, or any other place where you usually stay. And a mailing address is needed. It can be a local advocacy organization, shelter, outreach center, or anyone willing to accept mail for you. There's one complication, Maureen might be able to help me with this. You should be a resident for 30 days before, voting, registering to vote. So that can make it a little complicated, but as a homeless person, there are ways that you can vote. So, without further ado, Amanda, you want to start since you're over there? So.
Sure. Right. So, hello everybody. My name is Amanda Straight. I'm the Deputy Director of Housing at Chautauqua Opportunities, and I'll be saying COI going forward. I've been with the agency for about 12 years. I've had a few different positions there. We run programs for the unhoused, and we work directly with the county. I have a lot of data and information. I'm not sure what people prefer. We don't have a PowerPoint or anything, but we want to give some time for questions and thoughts and perspectives. But I think the best way to start, and I can give this to you, Carmela, are the number that are currently homeless. This one? Hello? No? Is that working? Oh, yeah. Okay, hello. So I think we'll start to talk about the number that are currently homeless in our county, and these are those that are sheltered, so in one of the hotels right now. So, you want me to, or? Hopefully we have the same information. So as of today, there are 132 individuals in temp housing. 36 are families. There's one couple, 32 single females, and 63 single males. COI also has the Safe House, which is a youth shelter, and there are 6 that are there right now, and that's not counted in the 132. This is the highest number we've ever seen. We've never experienced this much homelessness in the county before, and the capacity for us to find places for them to live, it just doesn't exist. So I know some of the questions that we were asked. We have the Dunkirk Motel, which is for singles who are homeless. The Econo Lodge on Route 60 in Fredonia, Dunkirk, they actually stopped providing shelter for quite some time, but they opened back up for us again. COI has 2 single-family homes in the city of Dunkirk and 1 in Jamestown. There's the Westfield Thruway Motel, Clarion Point in Jamestown, Quality Inn in Faulkner, Budget Inn in Faulkner, and the UCAN City Mission in Jamestown, which is currently closed right now because of repairs that are going on. So there are places available, but they are very limited, and we're seeing so much of an increase after COVID. So with the pandemic and the eviction moratorium, there was a misunderstanding of what that meant. The message that came through to people was you don't have to pay your rent. The reality, can you not hear me still?
I was just going to ask you.
I'm so sorry. I'm so sorry. The people did not think that they had to pay rent. That was the message that came across. The reality was they didn't have to pay if they had a reason to. And so when the moratorium ended, so many people were evicted, the courts couldn't handle the amount of evictions that went through, and landlords lost a lot of money. So now the rents have increased to a point where they're more than most of our mortgage payments, and the availability is non-existent. And even though there are laws and rules in place to prevent landlords from discriminating against people who have a history of eviction, I'm sorry, I keep dropping. There are a lot of landlords that are refusing to rent to people that we're working with. So there's a lot of barriers in place. So.
Oh yeah, so everything Anne just said is absolutely correct. The way I like to look at it is infrastructurally as well. So we need a combination of things. We need not only emergency housing, supportive housing, transitional housing, and affordable housing. And that's where we run into this gamut. From all the data that we've seen, and from what I've been told from individuals who've been doing this work for 30 years here in Chautauqua County, this is the highest it's ever been that they've ever seen it, which to me is concerning, very concerning in terms of infrastructurally. And then the other piece that ends up happening as well that I think it's important to notice is that if our neighboring counties run out of space, they send individuals to the nearest county that has space and or availability as well. So that plays a role. We haven't had to do that, thank God, but we have come close a couple times this year, especially with the warming center not being up and running, and then what happened with UCAN. I just got an email just now that UCAN, there's no real timetable in terms of when they're going to open back up. They just they had the asbestos and then the gas leak. They just fixed those two, so hopefully here soon they're going to be opening back up. So it's multifaceted in the sense of what we're facing and from which angle to come at it first, and to try to stop the bleeding, so to speak. So it's hard work, a lot of work, and a lot of regulations that we have to follow, especially when it comes to the state level, when it comes to OTDA and how. It's not just a Chautauqua County thing, but even though it's a state thing, it feels like everyone is just depleting the services or depleted of services, especially downstate when they're dealing with a whole different dynamic when it comes to the migration and things of that nature as well, which is clogged up their system. Our system is clogged, our current system is clogged just due to the lack of infrastructure. So I think that's important to know as well.
Some of the services that are available, social services has a rental supplement program, which is a subsidy program, but that money went very, very quickly. And anytime there's an opening, it is filled pretty much immediately. Chautauqua Opportunities has funding for first month insecurity. We have depleted all of our money for evictions, and in the first quarter of this program year, we helped 73 families and have very, very minimal funding left. So we're trying to kind of rob Peter to pay Paul in a certain sense, to adjust things so that we can help more families. There's always a need for more money, but to your point, the fact is that there's not enough housing, and there's not enough affordable housing or safe housing. And I know that Jamestown, the city, is doing certain things to help improve the quality of the housing. And I'm just so glad to see so many people here, because a lot of the times we have meetings regarding homelessness, a lot of the focus is on Jamestown, because the apartments there are more affordable, there are more shelter options, and because a lot of the mental health services are in Jamestown, almost all of them, people are getting transported there, and then when they're released, that's where they end up. So, and same with people who are released from jail, because there's more options. So we really just, though this sounds very, very negative, there are positive things that are going on. We broke ground. Chautauqua Opportunities is building Hope Haven Women's Shelter in Jamestown, and they broke ground, I think, 2 Mondays ago. It's been a really, really long process, but it is a single women's shelter, and it is not a domestic violence shelter. The Salvation Army really holds on to that and does a great job. And I want to just clarify, because there was a lot of response from the newspaper articles, that is the reason that we did disclose the location, because it's not a domestic violence shelter. So I just wanted to clear that up a little bit. But we do have some statistics. Before the pandemic in 2019, there was 541 individuals that came for services in that whole year. And in 2022, there was 816. So you can see the numbers increased drastically. I manage the HMIS lead, which is Homeless Management Information System. So the intention is that every person in the county that is experiencing homelessness or at risk of being homeless is entered into the system so that we can let HUD know what's going on in the community and try to get more funding. We're not capturing everything. There's street homeless that they're not accessing services for a variety of reasons. It could be fear of interaction with the police. It could be they've had difficulty at certain shelter locations. So there's a lot of reasons why people do not access services. Yes, distrust for sure.
Yeah, across the board. I don't know what our numbers are. I'm getting that data, but I know last year alone in just the Jamestown Department of Social Services office, we saw 40,000 plus visits. Some of those are repeats, and some of those are brand new individuals, but that's just the high volume that we're seeing, and that's for heat, housing, emergency housing, so food stamps, and just the gamut. But it is a lot of people in a high volume, especially when our census, I believe, is 125,000. So it just puts things into perspective how the system, I hate to say the word COVID, but post-COVID has really just become overwhelmed.
Yeah, and that's kind of our motto in the nonprofit world is COVID was bad, but post-COVID is so much worse. We've had to just deal with the fallback of all of the changes, and I don't know, there's a lot of people that are in the room and trying to work towards the same goal, but it's just exciting to see more people. So I don't want to keep rambling, so if anybody has any questions, specific questions about the situation.
Do we have any idea how many street homeless people there are in the county?
So on it every year, and please just like motion me if I'm too far from the microphone. Every year, the Homeless Coalition completes a point-in-time count, and we have volunteers that go throughout the county and try to find people who are not sheltered. This year we found 6, but after the fact we were notified from people from the city of Jamestown that number is way too low. I don't know if those certain areas were not searched, but we think it's probably closer to like 30. So.
And that would include people who sleep in their car at night?
So that's just street homeless, like people who are in abandoned buildings, in encampments. I'm not exactly sure about the other numbers though.
Thank you.
Are there people coming up from the border that are part of this homeless problem?
Not that we've seen.
I saw in the paperwork that they had people in Faulkner, and I'll tell you there are people from this area.
Yeah, for the most part, it is local. We're working right now to see if it's more people from the north or south end of the county. I did have a meeting with, I can't remember the agency that's working with the migrants, but there are a lot of programs already set up for them. So I think that there's a little bit of a misunderstanding there, so.
What type of services will Hope Haven have for these single women?
So it'll be very comprehensive. The first floor is all office space, conference rooms, and the intention is to have any local service provider, mental health, drug and alcohol, counseling services, social services, anyone who's willing and able to come. So it's kind of a one-stop shop. It is located pretty centrally on Lafayette Street in Jamestown, so it's in walking distance of all the other providers if they cannot come there. So it'll be counseling, help with housing searches. COI is not providing like that type of counseling, but referrals to those places, and just a safe and clean and warm environment. We believe it'll be much better than the hotel. So.
I'm sorry, could you repeat the question?
Yeah.
So I get half the story.
Yes, she asked what type of services will be provided at the Hope Haven Women's Shelter. So the hotels they're good because they give people a space, but unfortunately there's no direct case management. We have workers at our agency who meet with them to help, but I think having that centralized location will be better.
Hi, Mark Buchanan here. You mentioned the number 6, right? Of folks that, okay, do you keep a follow-up with these same folks that you, that the number 6, like say if Joe Smo, do you keep a follow-up on him once he leaves any program that you provide?
Yes, yeah.
The reason why I'm asking that because number 6 is a very low number. And for me, growing up in the city of Dunkirk, I see way more homeless people just by going shopping.
Yeah.
So yeah, that's definitely a concern of mine.
Yeah.
And I'm willing to do whatever we need to work on that.
Yeah, and I think, and thank you to Susan for joining us this year. We're gonna do a lot more outreach for the point in time count next year, because the more volunteers we have, the more area we can cover, and the more accurate of a number we can get. So yeah, that's a very good point.
Absolutely.
Thank you.
I know of a homeless person in Dunkirk. Where would I direct that person?
Yeah, so the first step for anybody, if that is homeless, they need to go to the Department of Social Services. So the address in Dunkirk is it is 15 West Lucas Avenue.
I would like to know how much money our county is spending on putting people in motels, and wouldn't it be cheaper if we just gave that money to COI to help with rental assistance and things like that? Isn't it really expensive to put someone in a hotel?
So yeah, that's a very good question. It's a question we ask all the time, especially when we go to legislative meetings. So when it comes to the way the state works, for emergency housing, the state reimburses the county back. I believe we get reimbursed at 70%. So they're willing to pay whatever that amount is. But then when it comes to an individual who's ready, let's say single for and ready to get into housing, they cap their amount. So I believe their cap is like what, 300? So it makes it challenging, and we can't grab money from this pot and put it over here. State just wouldn't allow us to claim it that way.
Having worked with homeless in Dunkirk and.
Can't hear you.
Pass the microphone.
Pass the microphone, bro.
Thank you, sorry. Having worked with homeless people in Dunkirk, I have found that what happens is that people don't want to go to Jamestown. That seems like a very far away. And I just wondered if you've had issues with adequacy of services in Dunkirk as a result of that.
I can get my exercise.
I think we can both speak to this, but absolutely, the cost of rentals in Dunkirk, Fredonia, even Brockton, I'll just say North County, are substantially higher. So yes, and the biggest thing is if somebody becomes homeless and they work in Dunkirk, or they have doctors or counselors in Dunkirk, and then they have to be, the only option for them is in Jamestown, yeah, that absolutely, it's a difficult thing that we deal with, but at some point, when someone is living in a hotel they don't have adequate facilities in those locations, sometimes it is a better option to move, so.
Oh yeah, it's a great impact because of just the geographic location is removing them from possible supports and things of that nature, and their community at the end of the day, which is important as well. One of the pieces that's, and we were just talking about this earlier too, I was speaking to a developer, and at the end of the conversation says, I'm willing to have another conversation, but I'm gonna need you, the mayor of here, the mayor of over there, I'm gonna need the people, the county exec, everybody there to have the next conversation because they get a lot of pushback. They just developed in Syracuse, they just developed in Erie, and in New York City as well. And it is a long process. It does take anywhere 3 to 5 years, and they have done it in multiple locations, but they said the biggest challenge is receiving buy-in from everyone when it comes to the development of these types of housing, whether it's supportive, emergency, and or affordable.
most of the homeless I know are couch surfing. And I want to know, how do you capture those numbers? I have 3 of them living with me, or have, and I just wondered, how do you capture those numbers? Because that's where they're going. They're sitting on people's couches, they're not sleeping, and that's why you're not. That's why 6 might seem like a low number, but it's probably about over 100 that are couch surfing. And how do you get those numbers?
The hard reality is that we don't. The HUD definition of homelessness generally doesn't include couch surfing. So if they're in an overcrowded situation, they could be counted. If they're fleeing a domestic violence situation, if they're literally on the streets. But typically, if someone has a place to stay, even though it's not, I know, it's not the reality, and that's the problem. There are so many more that are not in ideal situations, but if they are not reaching out for assistance, then we would not capture those numbers.
So you mentioned that the first step is to go to social services, I think?
Yeah.
But is that like 9 to 5, Monday through Friday?
Yes.
So if there was an issue at some other time, is there any?
So after hours issues, nights and weekends, so we do work closely with the law department, and they do have the vouchers to be able to put them in a hotel, and we also have Code Blue with recovery options made easy. So that's emergency, and they would be informed, hey, as soon as the morning comes, go to nearest social services department to get more established care. So we do have a system that we have to look at all the time because the numbers have gone up. So the system worked at one point when it was 40 to 50. Thank God, knock on wood, I hope this is real wood, we haven't had anything drastic where we had to send anyone to area or anything else like that. But once again, there have been some nights where we were crossing our fingers, where we didn't know what would happen if we got 3 more people.
Yeah, Mike Thompson. Just a question relative to both of your experiences. I mean, ideally, what would you suggest we need to do to be the most helpful relative to this issue?
Support. I don't know if it's political support or just a general county support of building new housing. I'm sure you've all heard of NIMBYism, and you mentioned that as well. There have been projects that were going to start and didn't start. And I know that Dunkirk, the city of Dunkirk has a new project that we're very excited about, but advocating for more agencies to build more housing. If you know landlords, talking to them about affordability. I saw a 1-bedroom apartment, no utilities included, for $850 a month. We need to tell, the income levels in this county do not match that. And like I said earlier, if your mortgage payment is less than that for a single family home, there's a problem. Just being involved in the Homeless Coalition meetings, getting the word out to the community about what the problem is. I don't, and I hate this because I wish that there was a more straightforward answer, but the more people that we have involved, the better, so.
Yeah, I mean, from my military background, what we would need is the person to our left and our right to have the buy-in and to be willing just to allow these developers to come in, and or even if they're internal and homegrown, to be able to go through that process of building it and applying for the application. Our office is way more than happy to help with the application process and points of contacts when it comes to the state level and working through the procedure when it comes to the coding and things like that. It's really just coming together as a community and saying, okay, we know this is an issue. let's say we got this corner right here, we're willing to do it right here, and then gathering and let us get to work and get the organizations in there and help them and support them in gathering the funding needed to break ground. I mean, this women's shelter, I mean, I just been here, going on 3 years, but I heard this was a project that's been in the works for like 8, maybe even longer.
It's been a while.
It's been a while, and we just got it through. A lot of it was for numerous reasons. Funding was one, and everything else that you probably are aware of. And that's just for 16 rooms. And I mean, we know for a fact we need more than that.
I think one other thing is, and this might sound silly, but if you hear somebody talking about homeless, unhoused people in general, or those who receive a rental subsidy, or people with mental health diagnosis or substance use concerns, take a second and stop and remind them that they're human beings. I think that everybody can make a mistake, and a lot of people, many of us maybe in this room, are one paycheck away from an emergency, or we've been at that point one time before. And a lot of the customers that we work with, they fell on hard times, or they've made a decision, or whatever the case may be, but they still deserve a fair chance, and they still deserve to have a house to live in. So it's really tough to see people come in and say, yeah, the landlord won't rent to me because they know that I used to be any of the situations. So just, be aware of how you speak. When you're talking to people, if you hear them speaking like that, just have those conversations. I think little things like that help as well.
I have a question piggybacking off of what you had mentioned about the county not having services available on nights and weekends. I'm not from Chautauqua County, I'm from Schoharie County, it's in central New York, and my sister works for DSS, and part of her job is being on call one weekend out of the month. Is that something that could be implemented for Chautauqua County where they could have those services? Because I know my sister, when she is on call, the calls that she's receiving are usually regarding people that are unhoused that are looking for services in the middle of the night. Like maybe they had gotten kicked out, or that the place that they were staying at fell through. Is that something that could be implemented in Chautauqua County, or is that not in the budget, or there's like barriers between that somehow?
I would say, so there's a couple things there. So we do have on call, a perfect example for child welfare, and that's a state mandate. So then in certain counties, there may be already like a grandfathered in rule, and social services, I know this, on the temporary assistance side, it's not a mandate, it's not a state mandate to have those services. But I mean, it would be, I would say a couple barriers. It's not something that's completely out of this world. One would be workforce, most definitely. Another would be in the sense of budgetary and how do you budget it, and then fiscally, where's the higher need of the calls, what would that look like, would it mirror child welfare? So it would be logistically something that can most definitely be done. It'd be in terms of just volume, need, and then also having the workforce there that's ready to do it and can do it and execute it. Because this is the thing, and you guys should know this. When somebody gets hired for TA, temporary assistance, or I'm not even gonna talk about Medicaid, but TA, the training is extensive. Not just anybody can just go ahead and do it. So my data shows it takes at least a year for them to feel decent in what they're doing. In terms of the documentation, the systems they have to log into, the logistical craziness of what that system is. So that plays a role as well. Bigger counties, bigger resources, it's most definitely something that's doable. Is probably why. What county say this is from? Okay.
I have two questions. What time of year do you do your count of the homeless? Because when I talked to Bridget Michael yesterday at Rural Ministry, we talked about the count in the winter months is certainly going to be a lot different than in the summer months. So when do you do it?
So I'll just try to speak loudly. And this is a HUD requirement, and it's interesting. It has to happen in January, the last
okay.
week of January. So it's tough because there are some places in the country where it is a fine time. This year, the weather was much more mild, so it was,
Yeah.
you know, they're more likely to have people outside than normal. But yeah, that is the HUD requirement. They also only require it every other year, but we do the count every year to try to be more consistent and catch what's going on.
And my second question is this: many decades ago, because I'm old now, I went to an Erie County meeting of major landlords. Some people would call them slum landlords, whatever you want to call them. And they brought up all their problems. The city talked very directly with them, tried to figure out how some of those problems could be handled. Right now, I can probably name 3 major landlords in Dunkirk, okay? They're very successful, okay? And one in particular, I've tried to talk to myself and so on. How often do you get these people together? Have you done that? Do you?
So there is a official landlord association group in Jamestown. It's called REIAAI. And they are a very well-established group in Jamestown. A couple years ago, my position was homelessness services manager before I got in this role, and I spent months and months trying to get Dunkirk landlords together.
Don't give up.
No, we're not. Our current homeless services manager and one of our inspectors is working very hard to get a group of people together. We sent letters in the mail. I did Facebook advertising. I believe I had an article in the paper saying, please, please, please reach out to us. And I also had a meeting with Nicole Cliff. She works for the city of Dunkirk a few weeks ago, and she's going to try to help with that, to try to see if we can get the landlords together, because we do have, in Jamestown, it's not an issue for us.
The only way it's gonna work, if you look at the research, is you have to go person by person. They're not going to respond.
Right, and another issue is that we are seeing so many out-of-state and out-of-town landlords, more than ever. We've got people from Canada, from California, and they may or may not have a property manager, but they may or may not want to speak to us. So you're right, that door-to-door effort, that's where we do typically have luck, but it's very hard to get a hold of people. So.
Our experience along this line very recently has been, I would say, frustrating by virtue of the fact that even though we have lived in this community for over 40 years, we don't know who these landlords are. We don't know how to get in touch with them. You don't see ads in the paper for properties. Right now, working with one of your clients, we are going by word of mouth and just happenstance that we happen to know the property manager for one owner. And it seems that there ought to be a better way, such as this clearinghouse, to simply make contact with those landlords to attempt to resolve this.
Yeah, so we use the Chautauqua County GIS. So if we see, and it's very infrequent, that there's a house that has a for rent sign out front of it, you can look up owner information. Doesn't have a phone number, so there's other creative ways to try to find them, like on social media. We go to those links. And that's something, if anybody is interested in helping with that, or if you have any ideas of how to get more landlords together, that would be huge for us, because 132 people or individuals are looking for housing right now, and it's very important. So any advice or suggestions on that would be greatly appreciated.
Yeah, I was just wondering how long people are on these services. Do you try to mainstream them? How many people? What is the success rate? That kind of stuff.
The average length of stay for 2023, I believe, was around 65 days. But it's tough because some people will exit shelter and then come back 2 days later. So it's very difficult to capture that. We do have a relatively high success rate of housing, but how do I say this? We also have people that get into housing that is not ideal because that is what is available, and then they return to homelessness. So that's something that we work on as well. The past 2 years, we have had relatively high success in retaining that housing. I believe for all of the programs, so that's emergency, transitional, rapid, and prevention, we had like a 23% return rate in 2 years, which does seem high, but some of them, that's an average, and some of the programs have like 12 people. So I think that there is a lot of good work being done, but yes, the length of stay is a concern still.
Jack?
I wondered, are there granting agencies out there that provide support to address this type of issue? Have you applied for some of those grants?
Yes, so OTDA, which is the Office of Temporary and Disability Assistance, Chautauqua Opportunity receives funding called STEP, which is Solutions to End Homelessness Prevention, and that includes money for rental assistance and case management. We also, from HUD, receive something called COC Rapid Rehousing, which is a program that helps with first and security and also ongoing rental assistance for a period of time. So say someone doesn't have income, we can help get them in there and then try to work with them to get that income to be self-sufficient. So we do have those 2 programs. We also have Section 8 through COI, and Social Services has funding. We just need more. There's always going to be a need for more money.
I'm thinking of an ideal world here. I grew up near Coax City in New York, and I remember Caprini Green. What do you see as the ideal situation for people that need homes and make them affordable and clean and whatever? What do you see as an ideal situation for any students that are in here for the future?
Enough available housing, but the right types. Yeah. I think there needs to be formal shelters. So a single women's shelter, domestic violence shelter, single men's shelter, and a family shelter. All of those need to be available with enough beds. We need to have a smooth process where it's a centralized intake system. We are very integrated. We work so closely with all of the agencies around the county, but a single point of access would be great so that they go through one intake and then everything is spread out so that they don't have to go to so many appointments. Each of those shelters would have to have intensive case management, really strong relationships with landlords, and also the transitional housing for people who need that extra support to become self-sufficient and stable, and then permanent supportive housing. I think the need for that has grown so significantly. There are some people that need that extra support. Living independently for one reason or another is it's not realistic for them. So if we had additional permanent supportive housing beds, we have very, very limited in our county, then people would be able to move into affordable housing and stay there and be comfortable and safe and clean and warm.
So, and I guess my understanding is that it's more expensive for homeless people it costs more in a year to
costs more in a year to support homeless people than it does if they're in long-term housing. I think there's significant, yeah, I figured. Can you talk about that?
Yeah, that's the minimum.
So the minimum payment for a hotel is $85 a day, minimum. So that's $2,550 a month. If you have larger families that need more than one room, you could double that. So that's $2,550 again. And in an apartment, it would be whatever the rate is. The fair market rent, I did want to mention that. So Before COVID, pre-COVID, the fair market rent for a 1-bedroom was $567. That is what HUD determined as fair market rent, and that is including utilities. Now in 2024, it's $711. So just that alone, the fact that that has increased, but what hasn't increased is the public assistance allowance, what people are receiving every month for public assistance. Social Security, although there has been slight increases, there's also been more deductions. And yes, some places have increased their pay, but not necessarily enough to match this, so.
Just to piggyback off of what you said, Amanda, I think it's also worth mentioning that we also need a better way to transition off of temporary assistance and services. Because right now it's an all or nothing deal. People who want to get a job and transition out of that type of lifestyle, it's next to impossible, especially if you have a family, which is why often you see people who are on it for quite some length of time because there is no weaning off of those services. You get a job, immediately you're cut off. So how do you have money to pay for, how do you make money to save for, a deposit, every month's rent, groceries, which are astronomical right now. Just as somebody who, has a sufficient job with a partner, and 2 kids, like, oh my God. So I think that needs to be said, and I think it's worthwhile for people to understand that that process is not very streamlined. It's not easy to transition back into independent living off of the system or off of that assistance.
I'm very glad you brought that up. So that is what you're referring to as something, they call it the benefits cliff. So I'm really, really glad that you brought this up. I remember giving a presentation to Andy Goodell where I talked about a woman that I was working with who refused a job because she was making less money working. She would lose her subsidy at where she was living, lose all of her food stamps, lose all of her childcare subsidies, and she could not afford to live working a job. That's the reality. They're not tearing things off. So when somebody is getting a rental assistance or all of those other things, like, what do? People literally refuse more hours at work. And then there's so many jobs, nobody wants to work. They can't afford to work. And it's really tough to see. And a lot of the agencies that even we work for, our grant funding limits how much we can pay people. So it really, thank you.
Yeah,
thank you.
And to add to that, if you have an individual, we've experienced many of the folks that we've worked with who have a medical issue. So it's not just the income and rental assistance and food assistance, but they can't be without health insurance because they will die. And that is huge. And that is an unanswered issue that isn't even being talked about, is people are dying from not having proper, adequate health care assistance. Because they get a job and if they have health insurance, it is way inferior to what they were getting on Medicaid.
Yeah, Medicaid.
Go single payer.
So my comment was just kind of on the jobs front. I work for the Office of People with Developmental Disabilities, and I'm a union rep. And I've advocated very hard and heavy to keep our jobs here in Chautauqua County and our services here in Chautauqua County. And part of that is the fact that those are really good paying jobs, and like our DSA title, which are our frontline staff, they start at $23.69 an hour now, and plus benefits and New York State pension. And one of the issues that our management has kept bringing up is that the jobs are leaving the county for our agency, and they've said, well, we can't hire people there. And I keep saying the end result is going to be communities decimated when those type of good paying jobs leave the county. And so, I've been talking to everybody I possibly can talk to try to get buy-in for finding ways, even more creative, to connect people to these jobs versus just saying we're giving up and taking these jobs out of the community. So, and I know there are many, like it's a multifaceted issue with homelessness, and there are many reasons why people become homeless. But I think ultimately, like, the loss of a type of job like that can result in homelessness. And I know I've worked with people who have said, look, if they move my job up to Buffalo, I'm not gonna be able to go. You know, my family's here, my friends are here. So, you know, I think that is, you know, decent, good paying jobs is one of those pieces of the puzzle, and trying to keep those jobs here in the community is something that needs like full support too. And I think like too, I even advocate for bringing more jobs in, because I know that our other state agencies as well, we provide services here in Chautauqua County, but a lot of times those jobs are based out of Buffalo. And so I've advocated, you know, we need to have those jobs here in this community and build those community relationships for those people that are providing those services as well. So, you know, I certainly don't know the answers, all the answers, but I do think it's definitely a piece of a puzzle for what that's worth.
In response to that.
Overall, we've had factories close, we've had layoffs, there's so many different parts to it. And yes, if we don't have the jobs, everything falls apart from that, so absolutely. And I think the advocacy and the understanding, and to your point, the fact that people are losing their lives, the fact that there are people that can't access services for whatever reason, we keep talking about it, but what can we do to move forward? And I'm not saying that what we're doing today is bad, because we need to keep doing this, but any advocacy on a higher level, I'm hoping that will get us results.
I have a comment and then a question on what you were bringing up. And did Andy Goodell tell you that? I mean, he told me this, that he is working on that. It has been for years, working on changing the things so it isn't a cutoff. It should be a gradual, you know, like your food stamps will go down by this much. You know, they do it for SSI. I used to work with developmentally disabled people, and it's really easy to do. For every $1 that they made, their check went down 50 cents. It was like, so it was, anyway. What I would do, or what I'm thinking for the league, because we are critical, is to find out if Andy Goodell is still working on that, and if he is, really give him support on that bill that he's trying to get passed.
Is he retiring?
Yeah, he probably is. Oh yeah, okay, well, maybe the next one.
No, but that's still.
My other question is, what is preventing you from shifting the money from all this?
The state.
The state. So we should be advocating for the state to let, because to me that's appalling that we're spending all this money on hotels where we could be buying houses and saying, you know, and as a taxpayer, you know, that we really should be addressing that. Are there state bills right now that we should be, are there any state bills that we should be pushing?
Not in reference when it comes to switching of the funds. The one, I think the one state bill it's not a bill, but it's a conversation that we should not support is they're in conversations of trying to make OTDAs flirting with the idea of making our hotels operate, if they're taking any of our homeless, to operate just like a OTDA state shelter would in terms of regulations. So security guard and all that other good jazz, which I was like, I said a couple of curse words there, but I was like, you lost your mind, because this will cripple a lot of counties. So it's something that, from what I was told, was flirted in 2019 when I was at NISAC a couple months ago. It got brought up again. I don't know how deep in conversations they are with that. I know the commissioners at the New York Public Welfare Association conference have lobbied and advocated in terms of more housing and finding creative ways to the monies and switch them and move them. We get a lot of pushback from the state, from the commissioners in the DSS world, from the state level. A lot of these laws and regulations are written by lawyers, no offense to anyone who's a lawyer, so it just makes it a little bit that more challenging when it comes to navigating that world. And I'm sure they wrote them that way for a reason. I think it's getting creative and innovative with the situation that we're facing right now.
I'm working with the New York State Bar Association right now. So there's a new, probably not president, but like head of the Bar Association, and he is very, very focused on homelessness. There are 6 or 7 subgroups. They're working on rural homelessness, homelessness in the law, availability of housing. There's a bunch of different groups. And so advocacy is happening that way. I'm trying to get more people involved in that process. But yeah, it is absolutely true. The way that everything was written years and years ago doesn't match the reality. So I'm hoping my little bit of input into that will be effective, so.
I came in late, so you might have already talked about this. I keep being surprised at the lack of available affordable housing, given that there are 2,000 fewer students at Fredonia right now than there were a few years ago. So I'm thinking there must be a lot of empty rental real estate around here. Why can't we find it? And why can't we convince those landlords who have empty places they might take a lower rate to house some of these folks? You know, is anybody working on that?
It's tough. It's really, really tough to convince someone who can get a ton of money per semester it's really tough to convince them to lower their rents. There is certain regulations on what can be considered a student rental, but the landlords in this town know how to word things the right way. And to your point, they can use them as Airbnbs for the most part, so they're still getting money. We have done direct advocacy to certain landlords, and we have been able to get a few to convert them to regular rentals. I think the more, as enrollment decreases, hopefully it doesn't continue to do that, but as it decreases, I don't know if there will be an option otherwise, so.
Maybe you guys can speak to the trend too, that we just have landlords across the country that have taken units offline, right? So there is a lot of empty inventory that is just not being leased at this point. Landlords getting out of business, not renting anymore.
I was the property coordinator for COI for 5 years, and I have regularly referred to myself as a recovering landlord. It's not like, it's not easy. It's not a money-making business the way that it used to be, and I don't want to keep saying it, but COVID really hurt people. There are landlords that lost thousands and thousands of dollars. They still have to pay their taxes. They still have to pay all the bills associated with it. So sometimes keeping them vacant is better financially, which is awful.
What I don't understand is, I'm just sitting here, what I don't understand is you have to pay $2,000 a month for one person. Why wouldn't you take the $800 a month rental? I don't understand that.
Can't switch the money.
Pardon me?
So the state would allow us, so that $2,000 for that individual,
Yeah.
the state would allow us for emergency housing, right? So that pot of money is there, and we'll get to claim it, and they'll cover 70%, county cover the other 30. What the issue is, we'll say, hey, can we use that money, and we have asked before, and just pay for whatever's left over. So if there's 300, we'll just cover the other 5, and it's cheaper. And the way the regulations are written, and they're not regulations, it's literally laws, public welfare laws are written. They won't allow us to switch it. It's at the state level, they would have to now either make a waiver or an amendment temporarily and or permanently to allow us to do that switch, which I'm sure will mess with the budget on their end and their final dollar, what it will look like.
And it's not sustainable. I mean, I can't afford $800 a month rent, let alone the people that we serve. That is not a reality. That's not sustainable. They cannot pay that.
Yeah,
I understand that.
To say, sure, stay here for a month, and then, then they want that year lease. I used to own rentals in Jamestown, so I would say that, having a lease in place, you're not guaranteed income, and you lose a lot, and end up foreclosing on the house because you have someone in and out every month.
There's a risk.
Yeah, there's a lot of risk on both sides.
Thank you for coming from Jamestown. We really appreciate it. And that's another thing too, I think what would be helpful is if you're from the north side of the county and you see any type of meeting that has to do with this and you're able to come to Jamestown, we need more of a presence from North County people.
Yeah.
You know that.
And the one thing I do want to share with you guys, and this was not planned at all on our end, but we had a young lady reach out to my office and said, I would like to have a meeting about the Riverwalk in Jamestown, actually, and the homeless that are there. So we go to this meeting. It's myself, John Anderson, and Diane Anderson, and we're meeting with this young lady, and she's telling us what's happening over by the Riverwalk. She's helping them out, and you know, she's advocating really, really hard for them. And then in conversation, as we're meeting with her, she was homeless. She was living out of her bag. She had just got kicked out. And I said, hold on. And you're here advocating for them. How can we help you? She said, it's not about me. And what we did was we finished the meeting. We created a plan how we were going to help the individuals that she came and advocated for. And then I told Diane, John and I are going to walk away. You're going to grab her. And let's see how we can help her. Long story short, just found out about 3 weeks ago, she's actually working. She's actually housed, not in a hotel, and she's actually not homeless anymore. But she came into the office not to speak for herself, but to speak for somebody else. And I mean, I know it's hard work that we do day in and day out, but just helping one person, I mean, it at least helps, hopefully, the system within itself. And if everybody could just help one person, I think we'll be all right.
I think we're coming to an end unless there's one more question. Anybody has any burning questions here? Sue?
I guess it's not a burning question, I guess. But what I wanted to ask was, you've mentioned a number of times, really you would like more advocacy and you would like more people to come to the Homeless Coalition. Is it possible to join the Homeless Coalition or come to the meetings and then have almost like, I don't know, an advocacy subcommittee? Or, because I think that sometimes what happens is people want to be helpful, but you don't necessarily know how to be helpful. Would that be possible if people signed up or came to the homeless to actually set up an advocacy subcommittee? I don't know what that would look like. Thank you.
Yeah, so my boss, Josiah, is the president of the Homeless Coalition. I'm the secretary. So I think if we have a piece of paper and you're interested in attending one of the meetings, they're online, you can put your email address on that and then we can talk about it. We have a lived experience committee of people who have experienced homelessness or domestic violence, and if we can get more community members involved, I think that would be fantastic. So thank you for that.
You know, that's a great idea. And me and Ms. Michelle here, we already had within conversations of putting together something like that. We had so we're working on, I'm actually working on something like that, so I think that'd be awesome. I will reach out to my colleague, Susan Parker, and fill her in on that, but that would be definitely a good idea. You know, so, because we need all the help we can. And I apologize to them. They reached out to me. They did several times. And I feel like so busy sometimes, and I just didn't get back, but that was an idea that we were working on and plan on to do that in the future.
I think that's so important though, because we all have so much going on, and it's so hard at one point to get everything together. And we're also a part, I am on so many subcommittees and groups and meetings and coalitions, and it would be great, and I think we're trying to work towards this, to just have one meeting, as unrealistic as that may sound, but to get everybody on the same page so that we're not all working at the same thing differently. So I think this will be great.
We'll go ahead.
One more. Thank you. Natalie Luchkowiak here. We're a special county because out of 62 counties in New York State, we're the 7th largest. I mean, if you take us from Silver Creek all the way to the Jamestown, that's a long way. So we have an equity issue in our county regarding a lot of rural areas. And I was just wondering how the outreach is. I used to be work with, in social services for a year, and they're from all over, the homeless people and the poor, and they have difficulty, coming to the city offices. So do we have an outreach to the rural communities?
So, I don't know. Diane Anderson came up with this idea in starting a homeless team. And we did. We started them in Jamestown. And the numbers were so high, we didn't even get a chance to leave the office because they were just showing up. But the goal was for them to actually go into the communities and go into these rural communities and actually meet the client where they were. So and these were volunteers. So we had 5 volunteers as a part of this team, and they were seeing an average of 40 people a day and doing everything right there. So the person to come in, they'll do the whole packet with them, everything, just everything from start to finish to try to speed up the process. And what we realized was, holy smokes, we need a bigger team. We didn't even get an opportunity to expand into the Dunkirk area. So we started in Jamestown. We figured we'll replicate it and do the same team in Dunkirk. We didn't even get the opportunity. And then we got people afraid to volunteer because they were like, they're working way too hard down there. But they're doing great work, and it's one of those things that we're looking at now. We need to make this more permanent, and how do we go about it and what training is needed. But yes, to answer your question, we had that idea, and then it just got crazy.
And to piggyback on that, I've worked with just about every county across the state now on this issue, and I think one of the successes we've seen for rural is a self-serve. Literally, the continuum of the coordinated entry group put a tablet in local libraries so that the people didn't have to get to Jamestown or have to get to Dunkirk or Mayville. They could go into their local library and link right in and have a face-to-face interview with that homeless team, and that's the way I think that we can address some of the human resource shortages but get to rural areas. And it's been very successful in some rural counties like Steuben, Delaware County, some of the larger ones. So
we work directly with the library system, but there's nothing formal in place, so I think that's a really good idea.
Yeah, they could just schedule meetings right there, so they didn't have to travel. And they put them in hospital ERs, which is a big spot for people to sleep at night, in the waiting rooms, things like that.
Anybody willing to sign up for volunteer work for Amanda? And here's a piece of paper. You can put your name and your email.
I don't know if you want to volunteer for me personally. Sorry, we've said a lot of very strong things that are difficult to swallow, but we have a lot of success, and I know Carmelo said this, but we help a lot of people. There are a lot of amazing agencies and people in this community that are so dedicated, and every time somebody leases up for a new apartment, or every time somebody gets a new job, we celebrate that. And so yes, a lot of this conversation was negative, or the reality of things, but it's not all dismal. And I think the more that we are able to share and get people together, the better things will be.
This room might be being used by another group, so we kind of have to wrap this up. Yes, Sue. Thank you, Carmelo and Amanda.
Before everybody leaves, I just wanted to remind you that the Dunkirk Rural Ministry, the Chautauqua County Rural Ministry, has a table out here, and these folks from Jamestown, the Live Love Jamestown Coalition, have a table out here, and so if you are all would like to help them out with a little donation, they'd be glad to receive it.